Initial microscopic examination of semen analysis. An initial microscopic examination of the sample involves scanning the paration. Agglutination of spermatozoa means that motile spermatozoa stick to each other, that is, few sperms are sticked like head to head, midpiece to midpiece, tail to tail, or mixed. For in mixed, the head or the tail part will be stick together, or the mid piece or the tail part will stick together. The adherence of either immotile or motile spermatozoa to mucous threads, to cells other than spermatozoa, or to debris is not considered agglutination. The motility is often vigorous with a frantic shaking motion, but sometimes the spermatozoa are so agglutinated that their motion is limited. In this picture, it is shown the agglutination. The grade 0 is in this. There are no sperms stick together. They all are separated. And in grade first, this is the head-to-head agglutination. The all heads are stick together with each other. In grade second, it is the tail to tail agglutination, and the grade third is the mixed type of agglutination. Now, the cellular elements other than spermatozoa. The ejaculated contains cells other than spermatozoa, sometimes of which may be clinically relevant. These include epithelial cells from the genitourinary tract, as well as leukocytes and immature germ cells, the latter two collectively referred to as round cells. This is the picture shown here. In this, there are many cellular elements shown in this picture, like debris and the other leukocytes and round cells. Now the other is sperm motility. Sperm motility may be affected by many factors like patient's age and general health, length of time since the last ejaculation, patient's exposure to outside influences such as excessive heat or toxins, method of collection, length of time, and adequacy of handling from collection to analysis. There are three types of motility. The first is progressive motility. In this, spermatozoa moving actively either linearly or in a large circle regardless of speed. The second is non-progressive motility. All other patterns of motility with an absence of progression. Example, swimming in small circle, the flagellar force hardly displacing the head, or when only a flagellar beat can be observed. This is also known as a sluggish sperms. In this, the sperms are moving round and round. They are not moving in forward direction. The third one is the immortality. In this, there is no movement of the sperm is seen. The normal progressive mortality means progressive and rapid mortality is AB%. The normal AB% should be 32%. This is the picture of the sperm mortality. In the right corner, it is a poor sperm with poor mortality, and this in the left corner there is the normal progression of the sperm. Now the rapid fructose test in men with no sperm or very low numbers of sperm in the ejaculate. It is important to determine whether the sperm are not being produced at all, or whether they are being produced but are blocked from getting into the semen. A fructose test can help differentiate between these two problems. Fructose is only made in certain glands, the seminal vesicles, which may be absent in men with missing or incomplete ducts. Vitality test using eosin and nigrosin. Live spermatozoa have white or light pink heads. Dead spermatozoa have heads that are stained red or dark pink. If the staining is limited to only a part of the neck region and the rest of the head area is unstained, it is considered as leaky neck membrane. Not a sign of cell death and total membrane disintegration. These cells should be assessed as alive. If it is difficult to discern the pale pink stained head. Use nigrosin to increase the contrast of the background. This is the slide. In this slide, the transparent sperms which are seen here, or the shiny sperms which are seen here as the live sperms, and the dark stained sperms are dead. Now the sperm morphology. The sperm morphology shows the shape of the sperm. The morphology should not be abnormal. The normal morphology should be 4%. There are several defects like head, acrosomal tail, neck, midpiece defects. In this, there are various defects shown here. The head defects in this: detached head, large head, small, elongated, small acrosome is being seen here. There is no acrosome present. The vacuolated and irregular sperm. This next is semen analysis terminology. The first is normozoospermia. In these, all the semen parameters are normal. The other is oligozoospermia. In this, reduced sperm number. Asthenozoospermia, reduced sperm motility. Teratozoospermia is referred to as decreased abnormal forms of sperm. Oligoasthenoteratozoospermia is referred to as sperm variables all subnormal. The azoospermia is referred to as no sperm in the semen. Aspermia, no ejaculate, means ejaculation failure. Leukocytospermia is increased white cells in semen. Necrozoospermia is referred to as all sperm are not non-viable or non-motile. Thank you.